Do you need to go to the dentist every 6 months? That seems weirdly frequent. We don't go to see other doctors that often for checkups. What's the deal? Seems odd. Let's look at what actually happens at the dentist every 6 months. 1, we check the health of your gums, measure gum tissue pocket depths, assess bleeding, mobility of teeth, recession of gum tissue, inflammation, irritation. Are there any abnormal growths or sores on the tissue? 2, we check the health of your teeth. This may include x-rays. We're looking for decay, cracks, sensitivity, assessing your bite relationship. Is there any abnormal wear happening with the teeth? 3, we clean plaque and tartar off the surfaces of the teeth and from underneath the gum tissue. This may also remove stains and improve the look of your smile. Yay! 4, potentially we apply more concentrated fluoride varnishes or foams if you're at higher risk for cavities. This helps protect your teeth. 5, we assess any cosmetic desires for improvement, discuss treatment options that could be beneficial to meet any goals you have. And 6, we discuss prevention and home care. We provide guidance on maintaining or improving health, a message that isn't always welcome, but that I try to pass on in the least judgmental way possible, because personally, I believe what happens at home and outside a dental office is way more important than anything that happens inside a dental office. Now, does all of that need to happen every 6 months? That depends on the patient. We give that as a guideline because there is a lot of variability. Some people need to come in as often as every 3 months. Honestly, in my opinion, some people could get away with seeing a dentist every few years or so. No big deal. It depends on a lot of factors, which I'm going to discuss in this video. Personally, I haven't been to a dentist since I was in dental school. Is that stupid? Maybe. Based on what I know about what causes problems for your teeth and gums and the way I take care of my teeth and gums, I don't think it's stupid at all. I think the risk I'm taking by not seeing a dentist is infinitesimally small. Very little risk. There will probably be a snarky dentist or hygienist in the comments telling me I'm risking oral cancer by not getting the soft tissues of my mouth checked, but based on my risk profile, I'm not worried about it. I don't even fall in a moderate risk category. I'm much more likely to die in all sorts of other ways I also never worry about. So I'm a dentist who doesn't go to the dentist. But then again, I know how to take care of my oral health, and I do everything necessary to actually do that. That's a big if. Most people don't know how to properly take care of their mouth and have never been effectively motivated to do the things that would be necessary to keep their mouth healthy for a lifetime. I know this because I constantly fail in my job to successfully motivate people about boring mouth healthcare stuff. So in this video, with my admission that I don't use dental services regularly, does that mean I'm recommending you never see a dentist? No, I'm not recommending that. Go see a dentist, all right? Most people watching this probably don't do it often enough. But based on what I know about teeth and gums and jaws, I'm very confident that I am preventing any potential problems with my behavior outside of a dental office. So I'm putting my mouth where my money is and actually living out what I believe. I'm running the experiment on myself. It's a small sample size, but it's something. I wouldn't feel right making this video if I wasn't willing to fully test everything I'm saying on myself. So I'm an experiment in seeing the dentist very infrequently. Again, not recommending that you do that, but I'm doing it to prove how much more important it can be to practice preventative medicine at home as opposed to relying on more expensive medical interventions. Also, I do take a set of x-rays on myself every couple of years to document that everything still looks the same and is healthy. So I am monitoring things to some degree. Again, why am I making this video? Well, it's well known that our healthcare system is struggling to actually improve health outcomes for people. Yes, we come up with increasingly miraculous surgeries to save people from dire states of poor health. Yes, that is incredible. This is not a knock on surgeons. Technically, I'm a doctor of dental surgery. I'm a surgeon, although according to many people, not a real one. At a minimum, I'm a fake surgeon. So anything negative I say about interventional medicine is an affront to something I spent a massive, exhausting portion of my life devoted to. Okay? This is not a takedown of the concept of surgery. Surgery can do some miraculous stuff. However, surgery has its limitations. Like our healthcare system at large, our dental healthcare system is also struggling to actually improve and maintain dental health for large portions of the population. What I don't want to have happen because of this video is that all of the people who never go to the dentist say, look, the dentist on YouTube, the TikToky YouTube dentist thing said I never need to go to the dentist. I knew it was all a lie. He said it on the YouTube TikTok, right? The people who most need to see a dentist probably aren't going often enough. The people who least need to see the dentist are probably going the most and like maybe more than they need to. And then there are some people in the middle of the pack, they're going an appropriate amount for them individually. That's what we want, that sweet spot where you go to the dentist or any healthcare thingy, what's appropriate for you. I said that really well. So again, we make this 6-month recommendation because the goal is to monitor and catch problems early on for as many people as we can. It's nice to spot a problem when it is just beginning to develop, as opposed to waiting until you have a toothache and showing up at the dentist for the first time with this major issue. That means it will cost more and the treatment will likely not last as long because a bigger repair has to be made. All of that being said, I understand the desire for more individualized recommendations in healthcare. Healthcare is not one size fits all. Everybody is different. Everyone has different needs. I think individualizing and targeting dental care and healthcare should continue to be a priority moving forward. It's just more efficient overall. Why waste time in a dental or medical office if you don't need to be there, right? Like that's a kind of waste of everyone's time. So why not free up a spot for someone who would benefit from being there more? And let's encourage the people who need to be there more that that's the right move for them, and help them feel more comfortable and also capable of doing that, right? I understand that a lot of people are unfamiliar with the dentist, they're scared of the dentist, they don't feel like they can properly utilize our existing dental healthcare system. I think that should be the goal. I also realize the best laid plans of mice and men often go awry, but I still think more individualized and targeted care is a worthy goal. All right, so individualized care. For the purposes of this video, let's break this into 4 categories of patients. These categories are somewhat arbitrary. They are not, I repeat, not evidence-based guidelines from any authoritative entity in the dental world. These are my general guidelines that I think can be useful. This is me saying this. Feel free to ignore my opinions. Ultimately, you have to trust your individual healthcare providers, but I think this is helpful. So here's 4 categories of patients in terms of frequency of dental visits. Hey, this is you. Yeah, this is important. Pay attention to this, okay? Yeah, you. Read. Category 1. Patients under 50 years old who have never had a cavity or who have only ever had, 2 or 3 small cavities and have not had a single cavity for 5 years or more. These patients would also need to have healthy gum tissue measurements each year when their dentist measures their gums. You're young, you have minimal cavities, you haven't had a cavity in years, your gums are healthy. You're category 1. Category 2, patients who have had a lot of dental work completed, fillings, crowns, maybe root canals, maybe dental implants, or in this category, patients who always seem to end up needing dental treatment, such as a filling or a crown every couple of years, just something's always coming up. Category 3, patients who have been diagnosed with gum disease that has not fully recovered and is at risk for future instability. It could get worse and cause tooth damage or tooth loss. This is gum disease that could result in instability of the smile and the bite. Category 4, patients who go to the dentist very infrequently, basically only when it hurts. If those categories sounded confusing, I'm about to go into each one in more detail. Again, these categories are not exhaustive. I can't describe every possible patient. Ultimately, the frequency of your dental visits is something you will need to decide with your dentist, but this should give you a reasonable guideline. Also, I made a separate video that talks about how often kids age 1 to 18 need to see a dentist. What are the most important keystone dental visits for kids? So if you want guidance about when your kids should see the dentist, check that out. All right, so category 1, younger patients who never have cavities and who have healthy gums. Basically, you're a star dental patient. You don't snack on a lot of sugary or carbohydrate-rich foods throughout the day. You brush every night. Heck, you might even floss regularly. Imagine that. Gums don't bleed. When your hygienist or dentist measures your gums, you hear a bunch of 1s and 2s and 3s. These are healthy measurements, right? You don't take medications that cause dry mouth. You get most of your fluids by drinking water throughout the day, as opposed to soda or juice or Gatorade or Monster or Red Bull. You haven't had a cavity in years. You've never had to have much dental work done. You're happy with your smile, and so is your hygienist, and so is your dentist. You don't really have dental problems. You probably do not need to be seeing a dentist every 6 months. It's cool if you want to, but it's probably overkill. You can save your time and money and spend it on something else. Invest it, right? Save for other impossibly expensive things like funding children's college. Talk things over with your own dentist first, obviously, but you can probably only show up every couple of years and be just fine, as long as your habits continue as is. If going at least once a year makes you feel better, that's also fine. Lots of people get surprisingly nervous about this, which is funny because the people who aren't nervous about it are the ones who show up like every 5 years. It's a weird problem to try to fix, but I'm trying to fix it on YouTube, of all places. The only exception to this could be if you're getting older. I'm not here to call anyone old, I'm sorry, but if you're over 50, there is an argument to be made for seeing the dentist every 6 months. Oral cancer rates overall are low, they're very low. It's not that common, but it's more common over age 50. It's most common from age 60 to 70. It's more common for men. It's more common for Black and Hispanic men. It's also really important to catch oral cancer early, because if you catch it late, it can be very deadly. So if you're a little older, taking the time for an extra piddly little dental appointment to have your mouth and throat checked, probably not the worst idea. Even if you take immaculate care of your teeth. I know cancer is a touchy subject. I'm not trying to offend people here. Can you get oral cancer when you're younger? Sure. But we have guidelines because there is a need to be practical. You may have heard that the age for mammograms, for instance, was recently shifted to a little later in life. That's because the extra screenings at an earlier age were deemed to be excessive. If you're super worried about it, by all means, go get checked. But I don't feel great about scaring young people into dental appointments with a cancer boogeyman. That's kind of icky to me. Why else should you consider seeing the dentist more as you age? Older patients may also start taking more medications. Not always, but sometimes. Life happens. Lots of medications cause dry mouth. Dry mouth puts you at increased risk for tooth decay. So even if you never had cavities in the past, if you develop dry mouth as a side effect of medications, you may need a little extra help preventing cavities. You can talk to your dentist about more concentrated prescription fluoride toothpaste. You can use that at home, as well as concentrated fluoride treatments that can happen at the dental office. Those things can help prevent tooth decay. The most important thing is that you maintain tooth healthy habits at home. I made a video about dry mouth that gives you more details on that. You can check that out as well. Category 2. There could be several reasons you're in Category 2. Category 2 would be patients who ought to be seen every 6 months, the standard, maybe once a year in certain cases. If you have had a lot of dental work in the past, fillings, crowns, maybe root canals, maybe dental implants, you have a partial denture, dental work can hold up well, but often not as well as natural teeth. So if you've had a lot of work, you should have your dentist keep an eye on things. Many things can start to go wrong without you noticing or having any pain. Fillings can get leaks around them and debond from teeth. They can get tooth decay underneath them. Lots of patients think that crowns can't get tooth decay underneath them. That's not the case. Crowns change the way teeth look. They protect teeth that have big fillings or root canals from fracturing, but crowns can absolutely get decay underneath them, and if it goes on too long, you can lose the tooth. It's really important to floss around crowns. I repeat, keep your crowns clean by flossing around them. Dental implants can fail the same way as teeth can. Implants can get gum disease. You have to clean around your implants well and have them monitored closely with periodic x-rays to make sure the bone is staying healthy. Root canal treated teeth can get reinfected. I've seen lots of patients who develop infections around root canal treated teeth and they don't feel any pain because the nerve isn't in the tooth anymore. You may think, okay, I'm not in pain, what's the big deal? Well, you don't want to leave an infection in your jaw gradually eating away at your bone, even if it doesn't hurt. That's not a good idea. It can spread, it can cause problems with other teeth. You don't want that. So, if you've had lots of dental work in the past, even if you are taking excellent care of your teeth at home at this point, which I love, that's awesome, keep doing that, you rock, but you should still see a dentist every 6 months to catch any new problems or issues with previous work before things would get out of hand. If you're taking really excellent care of things, maybe you and your dentist can decide on being seen once a year, but I really wouldn't push it out too much further than that. The second group of people who should still see a dentist every 6 months would be patients who seem to always end up needing some kind of dental treatment every couple of years. Something just seems to come up. You don't consistently not have any issues. You may not have much dental work in your mouth currently, but lately things have come up. Maybe it's a filling, maybe it's a crown, maybe it's some early stage gum disease. If you have new problems cropping up on you consistently and your oral hygiene isn't stellar at home, probably smart to keep seeing the dentist every 6 months. I'm not saying that has to be your life forever. If you can put together a streak of several years without a single dental problem, I think you can talk to your dentist about having less frequent visits. I've got lots of videos on my channel that could help you switch up your habits and become a preventative dental care master. I know that's what you all dream of, becoming preventative dental care masters. You could definitely bump up into category 1 if you commit to some education and habit changes, but best to play it safe for now. Category 3, you have a history of gum disease. If you go to the dentist regularly, at least once a year, they should take measurements of your gum tissue around your teeth. This is important. Gum disease ain't no joke. It causes lots of people to lose their teeth. If you smoke, you're at increased risk for gum disease. If you want to quit smoking, I made a video about that. Some different ideas that maybe you haven't encountered before. I'll link that in the video description. Go get it. You can do it. You're mighty. Be smoke-free. I believe in you. So we take these measurements. What do the measurements mean? It's how deep this little tiny ruler we use goes under your gums until it contacts bone. You want the pockets to be small, shallow. That means your bone is healthy and high up around your teeth, holding them in place. When you lose bone around teeth, the pockets get deeper. So when they're reading out numbers at your appointment, you might start hearing more 4s, 5s, 6s, or even worse. That means you'll need to have a special type of cleaning from your hygienist. If you get pockets deeper than 6s, you'll also likely go to see a specialist called a periodontist. So if you have these gum tissue problems, your dentist will likely talk to you about coming in more frequently to see them, probably every 3 months or so, 3 months instead of 6 months. You need to have your gums and teeth cleaned more frequently. And it may be that you see the periodontist every 6 months and your dentist every 6 months, so you're ping-ponging between the two of them every 3 months. One of the things patients get turned off by with these 3-month cleanings is that dental insurance doesn't cover it. Dental insurance isn't really dental insurance. I would not base almost anything that you do in terms of dental care off of what your dental insurance says, because they really don't understand dentistry at insurance companies. They understand money, and that's about it. You should make decisions that are best for you. And I understand that that's going to be a combination of what you can afford and, the healthcare that's appropriate. But most of the time, your insurance companies can't give you appropriate guidance on that because that's not how they're set up. So they typically don't cover these more frequent cleanings. But if you need these more frequent cleanings, if, they are necessary to keep your teeth healthy, then you have to make a decision for yourself. Is it worth it to keep my teeth healthy? and to kind of ignore what your insurance is telling you. If you want to hear me tell you everything that I think is messed up about dental insurance, I made another video about that. You can check it out as well. So yeah, these more frequent cleanings may not be covered by your dental insurance. That really shouldn't be the major factor in making your decision, I don't think. You should make the decision based on whether or not these are necessary for you to maintain the health of your mouth. That would be my advice. So there are nasty bacteria down there causing an infection that you can't fight at home by yourself. That's the problem. If you have gum disease, it is super important that you floss every day, right? Like more important to floss than with other patients. And it's important for other people to do it too, all right? You gotta floss if you have gum disease. You gotta floss if you have gum disease. You need our help to help fight the gum disease, but we also still need your help. If you ever get to the point where your gums aren't bleeding all the time and your pockets shrink back down and are shallow again, you may eventually be able to back off to 6-month cleanings, but you'll need to be cleared by your dentist and periodontist first, right? We want to do what's going to be best for you long term. Sometimes you just got to do more frequent cleanings, you know? If you want to keep your teeth, unfortunately, sometimes that's what it takes. Gum disease sucks. It's no good. Never smoke, kids. Just don't do it. If you already smoke, quit, all right? I don't say that in a mean way. It's because I believe in you. Go watch the quit smoking video. You can do it. You are strong. You are mighty. You are powerful. Category 4, patients who go to the dentist very infrequently, basically only if something hurts. The wild card category. I actually can't tell you how this one is going to go. I can't tell you how it's going to turn out. You're kind of putting on your dental sorting hat if you haven't been for a long time. Like I see some patients who haven't been to a dentist in 10 years and their teeth and gums look immaculate, just beautiful. Like you just like, you know, Michelangelo should sculpt these things, you know? I see other patients who haven't been in 10 years and it looks like a hurricane full of bombs attacked their mouth. It's just, woo, yikes, you know? You're gonna come in, we're gonna look at everything and come up with an individual plan for you. It could be awesome, could be not the best. Either way, I'm not trying to be mean, like we'll figure it out and keep heading in the right direction, moving forward, right? That's all we can do, right? If you got hit with a hurricane full of bombs, you got hit with a hurricane full of bombs, all right? Life is harder for some people than others, but we can still try to fix it. If you haven't been to the dentist in years and you want to make a good first impression with your new dentist, I also have plenty of videos on my channel that maybe could help with that. So keep that in mind if you're trying to build up your courage for that first dental visit. I definitely recommend getting established with a new dentist if you've been away for a long time. It's better to know what's going on with your mouth one way or the other rather than being in the dark about things, right? You want to know where you stand so you can take appropriate action, you know, or maybe just keep chilling, you know, maybe everything's fine. Wouldn't that be nice? Just get some good news. I do see a lot of patients who come in and they're like, oh, my mouth is going to be horrible. And I look and I'm like, no, everything's fine. You're good. Keep doing what you're doing. So it's not always bad. So yeah, hopefully that's helpful. I really hope it is. If you want more confidence about dental care and dental visits, I have lots of videos on my channel to help. You can check them out, ask me questions. My ultimate goal is to figure out the most effective tools I can give to as many people as possible to keep their teeth healthy at a lower cost and, you know, just more efficiently. Cost and access to care are major problems in healthcare today, and they are difficult to solve, legitimately difficult to solve. I'm trying to help figure out some of that. So I'm a dentist who never goes to the dentist because I believe 100% in preventative dental care. And like I said, I'm putting my money where my mouth is. I don't know if that even makes sense, but seriously, something I have come to learn is that natural teeth are more resilient than teeth that have had dental work, right? My job ultimately weakens teeth. Like some teeth need to be weakened, right? It's better to have a filling than have a cavity, but it's better to have no filling, right, than a filling. Do you follow what I'm saying? The most effective dental care is preventative dental care, right? It's also the least expensive. Like that's pretty rad when you think about it, you know? I think it has a lot of potential. I think the best healthcare is ultimately psychological and behavioral, but I want to help figure out how to achieve that in a practical way for the average person, right? So if we don't actually achieve results, you know, it's all just theory. I also want to emphasize that everything is about probabilities in healthcare and life in general, right? The average person doesn't really exist. In the end, we are a bunch of weird individuals that get molded into an average by statistics. Ideally, you want healthcare to give you advice based on your individualized probabilities of having issues, not the average probability of having issues, right? So if you're someone who takes care of your teeth the way I advise on all of my YouTube videos, you do lower your risk significantly, right? If you don't have a history of past dental problems, you lower your risk significantly. Now, if you don't follow any of my advice or your dentist's advice, or you engage in high-risk behaviors and you have a history of past dental problems, you should be monitoring the health of your teeth, gums, oral cavity, lips, and existing dental work more frequently. That just makes sense. If you take your car off-roading, every weekend, you probably should see a mechanic more often. I can't really give a blanket answer that will apply to all people, but I'm hoping this helps you sort out what applies most specifically to you. The other reason to go to the dentist every 6 months is that it is a reminder of healthy habits for taking care of your teeth. I actually think that's the most important thing about a dental visit. Educating patients so they feel empowered to maintain and improve their own health. If you can develop some kind of a relationship with a patient such that they trust you and see that you care, generally they are more likely to follow health advice, right? If they know that you're on their side. And dental visits are okay for that, but I think it can be more effective to have more frequent reminders than once every 6 months, right? That's why I'm doing all the YouTube, TikTok-y stuff. I know that in my life, my own life, I've needed much more frequent reminders and prompts to change my behaviors, right? If you told me to change the way I ate, or how I slept, or how I exercised, or how I educate myself, or how I pursue things I'm passionate about in life, if you only gave me one reminder to do those things every 6 months, I would never do any of them. I would never do anything. I have notes, reminders everywhere around my apartment telling me to do the things that I want to do, right? So I need a lot of prompting. So I'm here to be your reminder about how to have a healthier smile, right? I hope to be less of a nag and more of a positive cheerleader. You can let me know how that's going in the comments. I don't know, I'm going for a certain vibe here, but I don't know if it's coming across tonally the right way exactly. Go ahead and bark at me if you got some feedback. I'm gonna try to keep getting better. If you want dental health, you need to set up your own personal dental health system, right? That system consists of many small habits repeated on the daily, right? You couple that with appropriate check-ins with a dental health provider, and you're going to be on the right track for dental health the rest of your life. Unless some random shiz happens, like getting hit by a meteor, right? Nothing to be done about that. You got meteored. What are you going to do? I don't know, wear a meteor helmet? Speaking of meteors, today's video was sponsored by the films Armageddon and Deep Impact. It's amazing the royalties that are still coming in from those films years later to be able to, support a small YouTube channel like this one. But so big thanks to Bruce Willis, Liv Tyler, Ben Affleck, Steve Buscemi, especially Steve. Really love that guy and Mr. Deeds. Morgan Freeman, Elijah Wood, Jon Favreau, everything you guys have done with Iron Man, The Lord of the Rings, very much appreciated. Wilfred on FX was interesting. Thank you for that, Elijah. But yeah, thank you. Thank you for supporting the channel, Deep Impact, Armageddon. All right, I'll stop being insane. Okay, if you found this useful, please like, subscribe, tell me stuff in the comments, yell at me, be nice. I don't really care. I also do stand-up comedy. That's the other reason I'm getting into the content creation game. You got to build an online audience these days, or no one wants to let you tell jokes, which is the thing. So if you're interested in that, stay tuned. Don't turn that dial, kids.